really, this is about health. This is about us minimizing transmission. So it doesn't change anything that we're doing. We're already working very closely with these leadership at these facilities. So it doesn't really change anything on the public health side, and probably doesn't change what they're doing because they've already been very closely focused on messaging for each of those groups.
Statewide, the numbers have been essentially flat for new cases over the last 6 days. Cuyahoga County's gone from, 50 new cases a day to now 99 since Friday. So obviously kind of on the downside of that. Do you worry people will get complacent when they see these numbers?
The question is, it looks like statewide and also within the county that numbers maybe aren't as many new cases per day, and am I concerned that people will become complacent? Indeed I am, and that's why my messaging today is that we cannot let off. We have made a lot of progress, we really have, and we thank you all so much for making the sacrifices you have to stay home. Those of you who are furloughed from work, you know, we know that's not easy, and so thank you for doing those things. But we also know that this is not a time where you can say, well, it must be lower, I can go out and do a little more today, or not wear my, Cleveland Browns mask, or what have you, right? We can't do that. And I wouldn't necessarily say that we aren't going to see other days where we have more than 50 cases. I think we have a lot of testing here compared to other parts of the state. The testing is still limited. So if we get more testing, you will see more cases. And so that's one thing to remember. It doesn't mean that we don't have a high degree of spread right now. We do. We're still seeing new cases. So all those new cases have the potential to infect many, many, many other people. And if they don't isolate, it will be that many more people. So please don't stop. Please don't take this as we can pull back now. We will let you know when it's safe to do so in conjunction with our state leadership. But in this community, there is still a high degree of spread, and you'll continue to see that over the weeks to come with new cases.
Do you believe there's as much COVID-19 in the community as maybe there was 2 weeks ago, and it's just less testing?
The question is, do I believe there's as much COVID-19 in the community as there was 2 weeks ago, and is this just a reflection of testing? We will not know by actual numbers, but I will tell you that we still have a large number of people who are reporting symptoms who cannot get tested. So again, I'm reporting to you lab confirmed cases, but we still have quite a few people in the community who are reporting symptoms, and they're appropriately staying at home. They're not sick enough to be in the hospital. So we also know that there is a lot of infection still happening. I can't really tell you with any certainty whether that equals what was 2 weeks ago, but I can tell you there's still a lot of infection here.